owners of the land, the people of the Kulin Nations, and pay respects to elders past, present and future, and also pay respects to elders on all the lands upon which we're meeting today. My name is Professor Michelle Leach. I am a very proud alumnus of Monash University from back in 1987. I know that's hard to believe given my youthful appearance, but I'm very lucky to be here today with some really wonderful young Monash alum. So we have with us Dr. Chris Hardy, who is a Monash Medical alumnus. We have with us Georgina Wish-Wilson, who is a Monash Physiotherapy alumnus. We have with us Dr. Natalie Merkley, who is a Monash Occupational Therapy alum, and also Dr. Gabby Bolton, who is a Monash Medicine alum, speaking a little bit about rural health. So I'm really delighted to welcome our panelists today, and I'm so grateful to them for coming along to share their journeys with you all. They're all real bright sparks, and I think you're going to be very inspired by them. So if you're going to have questions for the alum, please feel free to use the chat function to ask your questions. And we'll be able to get to those at the end once they've introduced themselves and talked a little bit about their journey. So I'm now just going to invite each of the alum to describe their journey through Monash, through graduation and into early working life as a health professional. And I'm going to start with Dr. Chris Hardy. Thank you, Chris.
Thanks, Michelle. It's really cool to hear you call me Dr. Chris Hardy, just want to say. So hi, my name's Chris. I graduated Monash University with a Bachelor of Medicine, Bachelor of Surgery, with a Bachelor of Medical Science in 2019. I chose this degree because originally it was because I knew that Monash had an undergraduate medical course, and I was pretty keen to get started straight away in my medical career. The more I read about it, though, the more I realized that the curriculum and the way that Monash University teach the medical course was more suited to me rather than big lecture style learning. It was small group learning, very practical tutorials, and incredibly very early on placements, which I thought were the bee's knees. I was really keen for that. I guess the thing that I enjoyed the most about my degree, look, I think any degree at Monash is amazing. No matter what you do, you're going to love it. I think that all the faculties are fantastic, and any degree that you decide to do will open up amazing doors. For medicine, the thing that I've enjoyed the most, probably meeting people. I think, look, I love the curriculum, and I love what I was taught by incredible professors like Prof. Leach and other ones, yeah. But I think meeting some of the best people I've ever met in my life, and being able to call them not only friends but colleagues now, is just amazing. So highlights, look, there's so many. I'd need a whole other lecture to talk about the highlights. I think the main one for me was every year the Monash medical cohort do a med review, which is a big production that we write, direct, act, produce, just everything. And from doing that, from like a little green first year who was terrified of everything to a final year and being able to mentor the future medical students and doctors was just amazing. Career journey to date. So I'm, as it still sounds weird, but I'm a junior doctor at Ballarat Health Services, my hometown where I grew up. So I'm an intern, which is junior doctor, but the very beginning, a very baby doctor. So the kind of things that I do is involves like diagnosing patients, treating patients, talking to family members, liaising with other teams, doing some pretty cool procedures, and kind of helping out the team and providing like holistic healthcare with colleagues in allied health, such as physio and occupational therapy, who've saved my bum many times in the hospital. Monash was good with my degree because I feel that, again, with the early placements, you can read as much as you want and you can read all the textbooks and you can know all the theory, but getting out there and doing the placements is what really makes you be a competent medical student and a competent doctor. So I think the Monash degree really prepared me for this year, and especially I felt very comfortable walking into, or semi-comfortable, walking into my first intern job. Short-term career plans. I guess So I've been incredibly lucky to actually have a job at the Royal Children's for next year. So I was accepted to start my pediatric training, which is ecstatic. So at the moment, that's kind of where I'm heading. But we'll see after that, I guess. So go from there. I think you're muted, Michelle.
Sorry about that. I was just muted. Thank you so much for that, Chris. Fantastic overview. And I remember that Chris was very, very involved in all aspects of medical school life and was actually head of community and wellbeing, and was a great advocate for people from diverse backgrounds and supporting mental health. And I think that's the other thing about Monash, was the kind of support that students have for each other was just really inspiring. So I'm going to move on now to physio. We're already getting a lot of questions about physio, Georgina, so it's very popular area for people to think about. So Georgina Wish-Wilson, can you tell us a little bit about why you chose physio and your journey to date?
Yeah, definitely. Hi, everyone. So yeah, I'm Georgie. I graduated from a Bachelor of Physiotherapy with Honours Advanced Research in 2018, at the end of 2018. So basically, I chose to study at Monash for really similar reasons to what Chris has already said. I knew that the course was one of the only undergrad physio courses available at that time. And I really just wanted to get stuck in straight away. I knew that that was what I wanted to do. The course had an amazing reputation. I knew that it was taught by all the industry leaders, really. Something that was really important to me was that the classes were taught by physios. So we weren't just learning anatomy or physiology. We were learning what was really important for physios, which was definitely hands down the most important thing for me. And as well, the course layout seemed really, really logical, and the way that things progressed made a lot of sense to me, and it was how I wanted to learn. Similarly, with medicine, I'm assuming we had a lot of small classes, which was really important, more than big lecture styles. We had a really small cohort, so that was everything that I really wanted in a course. I was also already a student at Monash when I started physio. I already was studying a Bachelor of Arts in Science, and I decided to transfer across, and I loved it at Monash already, so I just really wanted to stay. So that's basically why I started at Monash and why I progressed through that degree there. Probably my number one favourite part about being a Monash student in physio was clinical placements. We got to complete so many placements in heaps of different areas. And I think that's, like Chris was saying as well, the most important thing is being able to sink your teeth in, apply the clinical theory that you've learnt, figure out if you actually really want to be doing this job. Because that's the most important thing is that you're going to like it. And we got to find that out fairly early on, which was really important to me as well. Outside of my degree, definitely highlights of being a Monash student was living on campus. I actually lived with Chris in our Hall Howard, which is a funny reunion, as well as sort of volunteering on campus, working on campus, really just being a part of the community there in sort of every aspect that you can be, which was amazing. Like Chris was saying, met some of my best friends ever, lifelong friends, and coming from someone that was from interstate, that was a really important part of coming to uni for me as well. And I knew that making a community was probably going to be the most important thing for me, being someone that doesn't have any family from Melbourne at all. So my career, which is a scary thing to say, I feel a bit young to be saying that I have a career. I'm a grade 1 rotating physio at Monash Health, which is Victoria's largest public health service. I've worked there since the start of 2019, and I'm a rotating grade 1, so that I've experienced about 6 clinical areas, I'd say, which has been amazing. Predominantly working to provide physio assessment, management, diagnosis to public hospital patients across the continuum. I've worked in places like the intensive care unit, surgical wards, community centres, rehab hospitals, really everywhere that you can work in a hospital, physios work. I'm currently working in a maternity, pelvic health and musculoskeletal split role, which has been super interesting. Really, my degree set me up exactly where I needed to be to start that role straight away as soon as I graduated. You had the qualifications to register with APRA straight away, and you're just a physio as soon as you graduate. There's no intern year or anything. You're there and you're a physio now. So placement and everything really set me up really well to be able to walk into my job day one and mostly know what I was doing, which was great. So yeah, that's really sort of my journey. My favorite part of being a physio is working in this amazing team of really intelligent people. learning. You're constantly learning. You graduate and you sort of know what you're doing, but there's so much kind of continued development that you have to do and potential specializations, and you need further training for those. But my favorite part about being a physio is the really quick decision making, managing sometimes really unwell patients and having to make really snap decisions, but also being a really important part of patients' recovery, and sharing in their success, and really just helping them live meaningful lives after illness or injury, which is something that I think draws a lot of people to allied health. At the moment, I really like rotating, and I get to sort of experience a new area of health every 4 months, which is really awesome. But generally speaking, my goal would be in the next few years, I'd like to specialise into something to do with critical care, surgical or respiratory physio. But who knows, that might change because I kind of like it all. But yeah, that's really me.
Fantastic. Thank you so much, Georgie. And I mean, I'm a rheumatologist by training, and I have to say physiotherapists are I'm in awe of what they do and what they can achieve and how they can get people moving, but also their amazing research skills. Some of the best researchers I know are physiotherapists. I have to say, I've never seen an unhappy physiotherapist either. Like, they always seem happy when they walk around the hospital. They just, maybe it's that sense of achievement, that they have. So thank you so much for that introduction. So now another discipline that I greatly admire, occupational therapy. There's not many things they can't do. So Natalie Merkley, can you tell us a little bit about occupational therapy and what drew you to it and your journey so far?
Yes, so hi everyone, my name's Natalie, and last year I completed the Bachelor of Occupational Therapy Honours degree at Monash University Peninsular campus. I started at Monash straight after year 12. Initially I wasn't too sure what I really wanted to do. I always knew I had a keen interest in health-related studies, and I also had a love for travel, and I really wanted to attend a top-ranking university like Monash. I spent my first 2 years completing health sciences and sciences at Monash at their other campuses, and then during this time I attended Monash Open Days. Attending the Monash University Peninsular Campus Open Day and learning about the experiences and opportunities of current OT students really contributed to my decision to transferring across. The honours component of the degree was another deciding factor for me, as I knew this would expand my knowledge and provide me with further opportunities once I graduated. I also really liked that Monash's OT course is an internationally recognised degree, and I knew this would support my love for travel in the future. My time at Monash is one I'll never forget. Peninsular campus is a small campus, so it's easy to make friends and you always feel really supported by your peers and academics. During first year, I joined a PASS class, which is like a study group run by students, and it provided a supportive environment to go over content and study with peers. It's something I would highly recommend all first years join. I loved the placement opportunities offered. It allowed me to implement my skills and knowledge into practice. I was fortunate enough to have placements in completely different areas, including geriatrics, stroke rehab and paediatrics. During fourth year, there's a huge focus on career development, and Monash offers support every step of the way, from mock interviews to CV writing sessions. So that really prepared me and supported me in entering the workforce. Studying at Monash was an amazing, exciting and fun-filled adventure, which has left me with many fond memories and lifelong friendships. During my studies, I became involved in the Society of Occupational Therapy, which is like a student-run committee that organises social events for the OT cohorts. My favourite event and the much-loved event by all would have to be the yearly OT ball. Early this year, I started working as a grade 1 paediatric occupational therapist at Peninsular Health. My role is primarily based at Peninsular Health's community health team across various sites, including Frankston Hospital and Hastings Community Health Clinic. Within this role, I work as part of a multidisciplinary team alongside various other clinicians, including senior OTs, paediatricians, speech pathologists, physios, dietitians, podiatrists, and audiologists, just to name a few. As a PEDS OT, I complete a range of functional, sensory and motor assessments, form client-centred goals with families, and I collaborate with the multidisciplinary team to guide evidence-based therapy intervention. Completing the Bachelor of OT at Monash provided me with the foundational skills to take that holistic approach when evaluating clients, and it supported me in my role as a PEDS OT, as I'm able to utilise OT-specific models to guide my clinical reasoning of therapy intervention. As my role widely consists of working in a team, clinical placement opportunities and my honours project prepared me with the skills to effectively communicate and work successfully as part of a team. And my honours project was focused on sensory processing and horticultural therapy, which really prepared me for my role as a PEDS OT because many of the children I work with have sensory processing difficulties. Being a PEDS OT allows me to be creative and supporting little humans to be the best they can be. Working with children brings out so much imagination. One day I will be pretending to be a superhero or a dinosaur at work, and the next I'll be pretending to be a princess. I love hearing the funny things children have to say, and I love that I get to see little people develop and grow. But I really love that I get to work as part of a team to support families. Since graduating from Monash, I've realised that learning doesn't ever stop. Every day I learn something new, and I'm keen to continue engaging in professional development to further my skills as a PEDS OT. One day I'd like to be able to take my skills overseas and utilise my degree overseas and make a difference to some other little people's lives. Being an OT is truly a rewarding experience, and I think starting OT at Monash is one you'll never regret. Good luck to everyone with your future endeavours.
Thank you so much, Natalie. I tell you what, I think you've inspired me to perhaps try and do an OT course now if they'll take me at this advanced age. I have to say, as a professor of medicine, sometimes on wards and things, we're trying to solve a problem and along comes an OT and just solves it just like that. I think occupational therapists are incredible problem solvers, and the diversity of what occupational therapists can do is just astounding. It never ceases to amaze me. So thank you. And I think we're hearing from all of these wonderful alum, the kind of thing that I'm so proud about being a Monash grad for is this whole Ancora Imparo thing, which is the kind of willingness to keep learning. And I don't think it's just hackneyed, but I think it is a real Monash thing. It's about, I still love learning every day. And I don't know if it's just being a Monash person or being human, but it's amazing. So lastly, Dr. Gabby Bolton is someone who I've greatly admired pretty much since I met her. She's a consummate musician, amongst other things. And when she was I can remember coming to visit and do a tutorial in rural Victoria, and she was in year 3, which is quite early clinical year. And she was already getting involved in anaesthetics and giving anaesthetics, and she said she wanted to be an anaesthetist, but I don't know if that's changed. So Gabby, can you tell us a little bit about your journey, getting in, where you are now, where you're headed?
Thanks so much, Michelle. Good morning, everyone. Welcome. So my name's Gabby. I graduated with a Bachelor of Medicine, Bachelor of Surgery in 2018. And since then have sort of been working towards the future, and as Michelle said, we're always still learning here. The reason I chose this degree at Monash, since I was 9-10 years old, I knew I wanted to be a doctor. And Monash University at the time, and still remains, the only university in Victoria that offers undergraduate medicine. The things that I really liked, I guess, about the degree itself was a result of coming to open days. I think I came since I was in about year 10 because I was a bit too keen, and just speaking to other students and getting sort of the insights that you can't get off reading brochures or going on their website and having a look and really seeing if what those people have experienced and those sort of people, if that's a good fit for you. And I thought it was. And when I got the email offering me a place, I was obviously over the moon. Given that I am here to talk about rural health as well, the range of metropolitan and rural rotations available to clinical students from a really early time. I think the first time I set foot in a hospital as a medical student was in first year, and our first sort of placements began in second year. We had sort of a couple of weeks in a rural hospital, and then from third year onwards, we basically spent all our time in a hospital. My time at Monash was amazing. Coming from rural Victoria, I was the only person from my school, only one from sort of the town I grew up in. Moving to Melbourne, it was quite scary. So living on campus as well was an excellent community environment to move to. I met Chris before we even started studying. I still remember vividly the first time I met him, and we've obviously been friends all the way through, and our group of friends is I'm just so blessed to have them, that I met at university, and that sort of being able to live on campus and live in that community really builds strong bonds that will last a lifetime. I think the clinical placements for me were a highlight. From third year to fifth year, we spend all our times in hospitals, and it really prepares you for becoming a doctor. It's still a bit of a jump when you graduate, having those letters, couple of letters in front of your name and having that responsibility, but the Monash degree really sets you up for that transition to be as smooth as possible. Highlights for me, as Michelle mentioned, I am a musician. I am classically trained in the violin and the viola, and I spent all my years at university playing in the Monash Medical Orchestra, mostly made up of medical students, but anybody at all is welcome to join it. And obviously at the moment it's not really happening, but it was an amazing outlet, sort of something outside of medicine, but still sort of building those friendships with your colleagues. And the other thing, from a rural health perspective, now I had to do a little bit of research for the allied health, but they do exist for it as well. So Monash University has a rural health club called Wildfire. Every university in Australia has one. They all have different names, but I would encourage you, if you have an interest in rural health, once you start university, to join that. Everyone from any health discipline is welcome to join. For me, I think a highlight as well for the Australian Medical Student Association is sort of the peak body. It's like the AMA of medical students. They have a rural health committee. I was fortunate enough to be the chair of that in my final year of university. But there's a number of other organisations, being like the National Rural Health Student Network and the Services for Australian Rural and Remote Allied Health. They're all student organisations that basically nationwide you can meet colleagues. So for myself, other future doctors, and allied health and nursing and midwifery colleagues with a similar interest to you, and then you can sort of not just have your friends within your own university, but people you know all over Australia, and go to their events, and it really sort of opens doors that you probably would have had otherwise a bit of a hard time finding in some circumstances. So to date, I am now in my second year working as a doctor. So I did my internship and have stayed on this year at Peninsular Health. I'm currently a critical care resident there. We have sort of a partnership with Gippsland Hospital in Warragul. So I spent 3 months down there as an intern doing emergency down there, which was really nice because that was the hospital that I did my first clinical placement at. So it was nice to come full circle from when I didn't know anything at all to when I know a little bit more, and actually have to do my job and have some more responsibility. And yeah, that was sort of a really nice, it sort of felt a bit like coming home, to be honest. As mentioned before, and as everyone sort of mentioned, Monash degrees set you up really well to be a junior doctor in my case. There's lots of practical learning. There's a lot of peer tutoring as well. We have groups called Vesper groups that sort of the year levels above you teach you, sort of supplement your formal teaching. And then the final year of medicine itself is basically just a preparation for internship. You basically work as an intern. So you're not sort of thrown in the deep end at the end of that to start your internship. There's lots I love about being a doctor. I've never for a moment regretted doing it, even though it is a lot of hard work. At the moment, I was fortunate enough to get a critical care resident job. I really love critical care medicine, the sort of acuity of it, the kind of necessity to make snap decisions. There's a lot of variety of clinical medicine, along with a lot of procedural skills, which is something that really was appealing to me. But as most people have mentioned here, the team work of medicine is is something that is absolutely an amazing sort of environment to work in. Doctors can't do everything, nurses can't do everything, physios, OTs, they can't do everything, but together we can all work together and get the best outcomes for our patients. They're also skilled in different domains. They complement each other beautifully, and just being able to work and sort of work side by side with people from so many different disciplines, to all sort of put in your sort of specialisation on that for the patients, is really, really rewarding to see, because at the end of the day, our patients are our focus, and that getting good outcome for them is the best reward for our work. So yes, Michelle, I'm still on the pathway to anaesthesia. So I've taken a job at Monash Health next year as a senior resident in anaesthesia. For someone who has a passion for rural health, this might sound pretty Melbourne focused, and unfortunately for something like anaesthesia, and I'll go into a bit later on with some of the other questions, anaesthetic jobs as a junior are pretty much non-existent outside of Melbourne to the degree that you can get them in here. But as soon as I can, I'll be heading back out to country Victoria, and hope to spend a large majority of my training time in the country. And so long term, I want to become a rural specialist, and I also have a keen interest in rural retrieval medicine. So I think that will pop up in the future, in the years down the track.
Oh, wonderful. Thank you so much, Gabby. How inspiring all of you are. I was about seeing a scenario where Natalie might be working with Chris in pediatrics one day, and you might be working with Georgina in critical care one day, because you seem to be all, heading in those directions. And also just to say as well that the Monash has a rural training hub, which is very much about trying to ensure that those pathways to training can happen in the country, or predominantly in the country, because the experience, of course, in rural is just absolutely incomparable in terms of training. So I think that'll be changing for the people who are now applying, coming into the courses, just to highlight that. But I just want to really thank you all. The questions are coming in thick and fast while you're talking. And so, we'll try and get through as many as we can. So I'll just say, though, that first of all, I'll ask Georgie. The first question that popped up was the career options for physios in terms of public and private. So, is it, can fresh graduates get into private clinics, or how does that work?
Yeah, so I guess the opportunities are really limitless. And a new graduate can absolutely get a job in a private practice straight away. A lot of people from my cohort went down that pathway, probably I'd say about half. And certainly it's what a lot of people come into the course wanting to do, is to go straight into private. I will say that throughout Australia, most of the placements that you'll undertake as a student will be in hospitals. That's just the way that physiotherapy training works, and there's no way around that. So if you're coming in only wanting to do private practice, you might be a little bit disappointed. But certainly the skills that you learn in hospital settings and in community settings are really important foundations for working in private practice. So a lot of people also will come in and do a little bit of time in hospital work and then go out into the private practice space. So there's a lot of room to move throughout the profession, but definitely most sectors would have a new graduate pathway available as soon as you finish. And there are options as a student to get sort of internships and do elective placements in the private practice space as well.
Thanks so much, Georgie. And for both, well, Natalie, I'll ask you first too, and Georgie can chip in. People are interested to know, can you transfer into OT and physio from other courses?
I think we both did that. So I definitely transferred from a Bachelor of Arts and Science straight into physio after my first year.
How about you, Nat?
Yeah, I transferred over. So I spent 1 year doing health science and 1 year doing science, and they were both at Monash, and I transferred over to OT. I think when I transferred over, there was the expectation of keeping a distinction average with grades to have a smooth transfer over. I don't know if that's changed now, but yeah, it's once you're in Monash, it's not too difficult to move around.
You have to maintain sort of high grades, but you both obviously did very well there. There's a question here which I think both Chris and Gabby, and maybe, I'm not sure, maybe you, Georgie, or Natalie have something to say on this, but it's about some students want to understand about what it's like living away from home to study. Like, is it hard to do? What advice would you give to people? Maybe we'll go first Gabby, then back to Chris, just for, yeah.
Moving away from home, it was sort of something I always knew was going to happen, but it doesn't make it any easier for the first couple of days, to be honest. I probably did cry for a couple of days at the start. I did miss home and miss my family, but we have all the ways of communication. I think for anyone really moving far away from home, living on campus would be something I absolutely recommend. I don't know that many people that sort of moved away to a private residence at the start of their degree, but I can imagine it feels very, very isolating. Living in, there's a lot of accommodation options at Monash. We call it like old halls, is where Chris and I lived. I'm not going to lie, it's not the most glamorous accommodation. It is very small. There are other options, more sort of modernised apartment sort of style accommodation, but the sense of community I've heard back, this was many years ago now, I don't know if it's changed, is not as strongly. There's also Mannix College, which is affiliated with Monash, where a lot of people move away. They do the whole supply all your meals, formal dinners thing. That was a bit too much for me, and it's quite a lot more expensive. So I would recommend the old halls, and I think Chris would as well. You meet people from everywhere. You have sort of enough room that you can escape if you need your own space, but there's always someone sitting around in the kitchen or the common areas, and they hold a whole week of orientation before the university orientation to sort of build that community, which is when I met Chris, and a lot of my other friends that live there as well. So you sort of have that community, you have sort of those friendships built to some degree before you even start the thing of studying and trying to get your head around adjusting from high school to university. So it's not all sunny happiness all the time. You will have moments that it is hard, but I wouldn't for a moment say that that would stop you moving. And yeah, live on campus. It will make your transition so much easier.
Okay, so being part of a community. And Chris, your thoughts on that?
Oh, I'm just a bit worried about what I did to be a vivid memory of Gabby's when I first met her. Look, I agree with everything Gabby said. Look, I think Georgie as well will probably say similar stuff to me and all of us. Like, it's literally, I haven't had as much fun in my life than living at halls. I did things that, like, I met people who I would never have dreamed of meeting. I met some of my closest friends are now, from the UK. They're exchange students. I've met fellow medical students. I've met students from other faculties. I can't put into words 2 years of living at halls and how much it shaped me into who I am today. So look, I won't go on about it because I think Gabby said a lot, but basically, 100%. If you get a chance, halls. It's just you will meet the best people of your life there.
Yeah. People are asking on the chat about Dean's Rural List, and I'll just tell those people to have a look at the website with all the information about Dean's Rural List for anyone who's interested. Very important thing to have a look at. A lot of opportunities there. So there's a question which is really everyone in a way. I mean, you're obviously all very high achieving students, very hardworking students. And, particularly I think you both mentioned, Georgina and Nat, that you were, getting distinction grade averages and things. You could have gone anywhere you wanted. Why did you choose Monash? Maybe I'll start with Nat. And
I just always really liked Monash. I liked its prestigious reputation ever since I've lived close to the Monash campuses most of my life. And so I always remember driving past them and really just liking them. And then when I started science and I got that sort of sense of community and the support from my peers and academics, I didn't really want to leave. And then all the sort of components that contributed to my decision to study OT, Monash really supported all of that. Like, it was an internationally recognised course and I got honours as part of my degree. It wasn't going to be additional study. And so, yeah, that's really why I chose Monash and chose to stay.
How about you, Georgie? Thanks, Nat.
Yeah, quite similar. So I flew to visit Monash when I was in year 12. I'm from Tasmania. And I knew, like, from the minute that I set foot on the campus for the open day, obviously it's a little bit challenging this year with not being able to come and look at the campus in person. But hopefully we can sell it to you. I knew that was a community that I just wanted to be a part of. And it felt like it was where I was going to make the best friends ever. And living on campus there was the best choice I've ever made. And I didn't want to leave when I decided that I wanted to transfer to physio. But then also looking a little bit into the course itself, there was a lot of rewards for high achieving students, which was something that I was really interested in participating in. So every Monash student at physio gets honours. But for me, there was also a pathway of about 10 of us, I believe, that undertook extra additional research training, which gave me a slightly different qualification and let me complete an entire thesis across my second to fourth years, which was an opportunity that I couldn't see available anywhere else without having to complete additional study after my 4 years were over. So that was something that was really attractive to me and made me stay at Monash. I believe it's still available in a slightly different way as to when I graduated, but it's something that definitely, if students are interested in research, Monash, especially if you're interested in physio, Monash is a really, really amazing place to be for that.
Yeah, I have to say Monash has got a research intensive reputation. And when I came to Monash last century, it didn't look like it looks now. But now we've got, some incredible cafes and bars and lawns, and it's really beautiful campus actually to be on, I find, nowadays. And all the campuses are quite beautiful, Peninsular and, very, very beautiful campuses. But I also think there's something about Monash, we're not a sandstone university, but there's this kind of feeling of, I don't know, a kind of progressive feeling, a striving feeling that I still feel today when I'm there. Gabby and Chris, why Monash? You could have gone anywhere around Australia, I guess you wanted to go. Start with maybe Gabby, go back to Chris. Sorry, Chris.
So I think the biggest draw card for me was the undergraduate medicine is why I chose it. Obviously, Monash had a good reputation anyway, but there are other universities in Victoria that have good reputations for their medical degree. So the undergraduate was sort of the driving factor behind that. Obviously, good impressions at open day as well. I did actually have a couple of offers from interstate universities prior to Monash, and staying in my home state for me was something that was really important to be close to my family. And I thought that probably where I studied and made my friends is where I would stay living, and I wanted to stay in Victoria. So all that sort of, I guess, culminated in wanting to come here. I didn't have the highest hopes. I wasn't one of those 99.95 ATAR graduates. I didn't get the best score in the UMAT either. I was on the Dean's Rural list, and I sort of sometimes suspect that's maybe how I got a place in medicine. But I think that the selection process, and it is the same a lot around Australia, I think, but the selection process of Monash actually interviewing for medicine is really good in that they actually see the person as well. They don't just see the numbers on paper of your scores and select you based on that. But so I think an institution that actually selects the person, not just the scores, was something that I really wanted to be a part of as well.
Yeah. Now, thank you so much, Gabby. Now, Chris, have you got one word to say? Because we have to wrap up. I'm so sad, but what would you say? Why Monash in one word? Anything?
Oh.
2 words. 2 words.
2 words. Just amazing. I can't, like, there's too many words. It's just best experience of my life.
Yeah, people. Well, can I just say, I have had such a beautiful morning talking to you, alum, and I feel so lucky that people like you are going out into the world. So all the best. I think we've been wrapped up now. But anyone who's watching, I'm sure you'll agree, these are very inspiring young people. And thank you so much for your time today.